Hello and welcome to Yoga as Therapy for Back Care. We'll begin this class on our backs in what's called Constructive Rest. You want your back flat on the floor, your feet flat on the floor, about 2 to 3 feet away from your buttocks, knees bent. Roll your shoulders back and tuck your shoulders under a little bit so that your shoulder blades are flat on the floor. If you feel like your chin is reaching for the ceiling, then tuck your chin and lengthen the back of your neck. And then check that you have an arch in your lower back, just a gentle neutral arch. And close your eyes here. Begin to notice your physical body in space. Notice where your body's touching the floor. And then notice the places that aren't touching the floor, like your lower back and the back of your neck. Those are the secondary curves of your spine. Begin to pay attention to your breath, slowing down and deepening your breath. Imagine that your torso is like a balloon, and you want to feel that balloon expand in all directions on the inhalation and contract in all directions on the exhalation. Notice the quality of your breath. If there are any places where it's challenging to breathe deeply, noticing if your breath is smooth and relaxed. And then bring your hands to your heart, just resting both palms down on your heart. And ask yourself what you most want for this practice. Set an intention, an I am statement, saying what you most want as if it were already true. I feel good in my body. My back is strong and flexible. I am strong and flexible. Whatever your affirmation, say it 3 times silently. And then bring your arms to your sides with your palms up. Count your inhalation and your exhalation, again making them equal to each other. You want your breath to be as slow and deep as you can make it without straining. If you're familiar with the Ujjayi or ocean breath, you can begin to use that breathing technique now. If you're not, then see the video on how to do Ujjayi breath. Or just breathe slowly and deeply to the best of your abilities. We're going to begin to add movement, coordinating our movement with our breath. So on your next inhalation, take the entire inhalation to sweep your arms up and overhead, turning your palms so that they're up and the back of your hands rest on the floor above your head. As you exhale, sweep your arms down, palms up, your arms come to your sides at the same time that you end that exhalation. Inhale, your arms up and overhead, and exhale, your arms down by your sides. Move with your breath. You're breathing as slowly and deeply as possible, so you're moving slowly as if you were moving through water. When you slow down your movements in this way, you allow your brain to be able to track your movements and increase your body awareness. And notice as you sweep your arms up and overhead like this, it's exaggerating or emphasizing the opening of the front of your chest to increase your lung capacity. And then as you exhale and bring your arms back to your sides, your chest and rib cage gently compresses. As your arms come up and overhead, your back naturally wants to arch. And then as you exhale and your arms come to your sides, your back wants to come back towards a neutral position. Begin to exaggerate this natural movement of the spine and the rib cage by increasing that back bend on the inhalation and by increasing the movement of your spine in the other direction, squeezing your belly in and pushing your lower back into the floor. Inhale, sweeping your arms up and overhead, arching your back. You can even tilt your head back slightly. And then as you exhale, bring your arms to your sides, push your lower back into the floor, and tuck your chin. We're warming up the spine. We're pumping the inner vertebral discs to increase circulation, increase blood flow, and to hydrate those discs. And on your next exhalation, draw your knees into your chest, bringing one hand to each knee with your fingers pointing towards your toes. Inhale, straighten your arms so your knees move arm's length away. Draw your shoulders back and down. Expand your ribs, your chest, your belly. As you exhale, draw your knees in, bend your elbows out to the side, and squeeze that air up and out of the bottom of your lungs. Inhale your knees away, taking the entire inhalation, and exhale your knees in, squeezing that air out. Continue with this movement. This is stretching the muscles of your hips, your lower back. It's exaggerating the exhalation, helping you to cleanse the stale air from the bottom of your lungs. And the next time that your knees draw into your chest, just wrap your arms around your knees or shins. Or if this bothers your knees, puts too much pressure on your knees, you can always wrap your arms around behind your thighs instead. Draw your shoulders back and take slow, deep breaths here, noticing where your breath goes when your abdomen is compressed. Keep your knees drawn in, bring your arms to your sides with your palms up. On an inhalation, bring your arms up and overhead and your legs straight up in the air, flexing your feet. Exhale, knees to chest, arms to your sides. Inhale, your legs straight up, arms up and overhead. Exhale, knees to chest, arms to your sides. One more time and hold. If it feels comfortable on your shoulders, you can interlace your fingers and push your palms away from the top of your head. You can flex your feet firmly, lifting up on your kneecaps to straighten behind your knees, and then point and flex your feet. If this is not accessible to you, if your legs are out here, for instance, then you're going to be using a lot more core strength and not getting the nice stretch in your hamstrings. So then instead you can use a strap around the mounds of your toes to hold your legs up to get that stretch in your hamstrings. And it's important that you straighten out completely so that you stretch out this ligament a little bit behind the knee. If you can only do that one at a time, then you can alternate to begin with. Or if to do that you need to have your legs further away from your torso, feel free to do that. They don't have to be straight up in the air. And whatever the best stretch is for you, you want to find that stretch and breathe slowly and deeply, bringing all of your awareness to the sensations in your body. What are you experiencing in your body right now? And then slowly release. You can bring your knees back into your chest. And then bring your feet to the floor, knees bent. Separate your feet out to the edges of the mat. Bring your arms out to your sides and then slide them up to a T or a Y if you're able to. Draw the shoulders and the shoulder blades down into your torso. You want to be able to let your arms relax completely here. So if they can't relax, if it's too big of a stretch in your shoulders, then slide them to wherever they are able to completely relax. Inhale deeply into your abdomen. Exhale, let both knees slowly lower to the left as you turn your head to the right. Inhale, lift your knees up, looking straight up. Exhale your knees to the right, looking to the left. Inhale, untwist. Exhale and twist. And as you move from side to side with your breath, notice the weight of your pelvis pushing into the floor so that you're increasing your awareness of where your pelvis is in space. Notice the muscles that are stretching and strengthening. The next time both knees come down to the left, you can let them relax there. You should feel a stretch in the front of your right hip. If you'd like a deeper stretch, you can bring your left foot on top of the right knee, but only if it doesn't cause pain in the knee. And then stretch that right arm diagonally up and away. Lift your head, turn your head to the right. And breathe into that right side of your body. Feel that line from your right fingertips all the way down the right side of your body to the right knee. And you can even actively stretch here if it feels good. Reaching your fingers and your knee away from each other, and then exhaling and relaxing everything into the floor. And on your next inhalation, release the pose, lift your knees and your head up, and then exhale, bring your knees to the right, turning and looking to the left. You can bring your right foot on top of the left knee if you'd like. Stretch the left arm diagonally up and away, lift your head and turn it to the left, and then actively stretch your left fingers and your left knee away from each other. Exhale, let your weight drop into the floor. Let everything relax here. Keep your awareness on your physical body and what you're experiencing in your physical body by being in this position. And notice how your breath is affecting this position and what you're experiencing. On your next inhalation, release the pose, lift your knees up, bring your feet and knees together, bringing them close in towards your glutes. Inhale. As you exhale, let your knees come to the left as you turn your head to the right. So another twist, but this one is coming up a little further into your lower back as opposed to your hips and pelvis. Inhale, lift your knees up, looking straight up. Exhale, your knees to the right, looking to the left. You can continue like this if this feels like a good stretch to you. If you'd like a deeper twist, and deeper is not necessarily better, so listen to your body. But if you'd like a deeper twist, you can draw your knees into your chest, and then as you exhale, twist your knees to the left as you look to the right. Inhale, untwist, looking up. Exhale, twist your knees to the right as you look to the left. And continue moving slowly in and out of the twist, whatever version you choose. And you want to notice which side is the easier of the two sides for you, because you want to come down first to the easier of the two sides. And just let your body relax into the floor. If your knees came to the left and you want to bring your left hand on top of the right knee to just hold yourself in that pose a little bit, you can, but don't force yourself into the twist. Stretch that opposite arm diagonally up and away, and a way to check the alignment of the shoulders to bring your fingers behind your neck and then draw the shoulder blade down into the torso. And whatever angle your shoulder, your upper arm is at here, that's where you want it to be. And then you can release your forearm. And you want this shoulder relaxed to the floor. If it can't relax here, if it keeps popping up, then move your knees a little bit further down away from your torso until the shoulder can relax. And then breathe into that diagonal line across your body. Exhale, let it go. Inhale, find the tension. Breathe right into the tension. And as you exhale, breathe it out. You can use what we call fallout breaths, which are really just big sighs, as another way to release that tension. So inhale into it. Exhale, breathe it out. And on your next inhalation, slowly untwist. If you're doing the deeper twist, then draw your knees into your chest, and on an exhalation, twist over to the more challenging of the two sides for you. You can bring the hand to the knee if you'd like. Stretch the opposite arm diagonally up and away, checking the alignment of the shoulder by bringing your fingers to the back of your neck, and then either keeping the arm there or extending the forearm. Breathe deeply into this diagonal side, finding whatever makes this the more challenging side. Find that sensation, that tension or tightness, and then breathe it out with big sighs. On an inhalation, untwist slowly. And then draw your knees back into your chest for neutral. Inhale your knees away, expanding your chest, your ribs, your belly. Exhale, draw your belly in and up, squeezing the air out. Inhaling away, exhaling in. And then bring your feet to the floor close to your buttocks. You want your feet hip distance apart, your knees hip distance apart, arms at your sides with your palms up. As you inhale, keep your buttocks on the floor, bring your arms up and overhead, arching your back. As you exhale, bring your arms to your sides and flatten your lower back into the floor. Inhale, arch. Exhale and flatten. One more time. And then exhale, flatten your back on the floor. Keep it here in this position. On an inhalation, push equally into both feet, and starting at your tailbone, peel up one vertebra at a time as you lift your arms up and overhead. And then exhale and come down one vertebra at a time. Inhaling up. And exhaling down. Make sure that you're not compressing your neck here, that your neck is nice and long and relaxed. Inhale up. And hold, push equally into both feet, both shoulders. Draw your lower belly in and up to protect your lower back. Try to relax your glutes as much as possible. And start breathing slowly and deeply, using equal effort and ease. Being as relaxed as possible in this active pose. And on an exhalation, come down nice and slow. Keeping your buttocks on the floor. Arch your lower back. Exhale, flatten your back into the floor. Inhale, arch. These pelvic tilting motions warmed us up for a bridge pose, a deeper back bend, and they're also a counter pose. So coming back from it in a slow, gentle way so that nothing seizes up or you don't cause more pain or discomfort. And then draw your knees into your chest. Inhale your knees away. Exhale them in. Inhale away. Exhale in one more time. Big breath in. Exhale, squeeze that air out. Wrap your arms around your shins or behind your thighs. Breathe into your back, into the sides of your torso. And you can rock from side to side if it feels good, massaging your back on the floor. And then bring your feet to the floor, coming back to where we started in constructive rest. A gentle arch in your lower back, arms at your sides with your palms up, shoulders tucked back, the back of your neck long. And notice your physical body in space. Notice the places that are touching the earth and the places that aren't touching, like your lower back and the back of your neck. And notice the effects of your practice on your physical body. Notice the quality of your breath and the effects of your practice on the quality of your breath. And then notice the state of your mind and the effects of your practice on the state of your mind.